Okay, you guys, welcome to my channel. Welcome back to my channel. If this is your first time here, then you should probably subscribe. Give you a second to do that right now. But I decided to, being interested in the healthcare field and nursing and everything, I decided that I wanted to do a series of interviews with people with illnesses. So I'm calling them the illness interviews. And I am here with my friend Bianca. I've known Bianca since we were in the second grade, apparently.
Yes, second grade.
You have Mr. Seifel. We have Mr. Seifel. Mr. Seifel was a police officer who retired and decided that he wanted to teach 7-year-olds, and
He was very mean.
he made one girl pee on herself because she was so afraid to ask him, "Can I go to the bathroom?" She felt like it was a better idea to just sit in your chair and pee.
Yeah, because he used to threaten students.
He did threaten us, and it's like, what? Anyway, this is Bianca, and we're gonna do her illness interview. So, Bianca, what is your diagnosis?
I was diagnosed with sickle-cell anemia.
Sickle-cell anemia. When were you diagnosed with sickle-cell anemia?
I was diagnosed at 6 months old.
6 months old. And what is sickle-cell anemia?
Sickle-cell anemia is a red blood disease, a red blood genetic disease that causes the cell to go sickle because of lack of protein, haemoglobin protein, which carries oxygen on the cell.
Okay, so your cell is shaped like a C instead of O.
Yes.
Okay. And what type of things do you go through because of having sickle cell?
Pain, crisis in my joints, basically all over, not just secluded to my joints. And damage, organ damage.
Okay. So what are some things that you can remember happening besides just, sickle cell crisis, because like certain organs or joints are not getting enough oxygen as sickle cell crisis, but something major, some major things that happen?
Hip replacements.
Okay, you got your hip replaced. Which hip?
Both left and right.
Yeah, left and your right hip are.
Total replaced.
So did they replace the femur that goes into the ball in the socket, or
Yes. That's what they replaced.
what? Okay, so you have to tell everybody before you go into the get on the airplane, right? Before you get on the airplane, you have to be like, hey.
They give you a card, a medical card
Okay.
that says that
I'm gonna be.
you have metals in your hips,
Okay.
so I don't get
So
tasered or something.
technically, you could bring some other stuff in with you too.
Not that I would do, because
Not that she would ever do that, but we'll talk about that later. I'm joking. But hip replacement. When did you have your left hip replaced?
Had my left hip replaced 2007,
And
had my right hip replaced in 2006.
okay. Besides hip replacements,
Besides hip replacements, I had my kidney taken out because of they found a mass in it, and it ended up to be a tumor.
which kidney?
Left kidney.
Left kidney. So you're working with one kidney on the left side.
I had my gallbladder removed because it was causing problems of my white blood cells to be high, which means infection.
Okay. And what else happened on your left side, as you were telling me?
I also have problems with ulcers on my left inner ankle. Probably because of poor circulation, but it's not really, they're not really sure.
Okay. And then you were talking about something else that happened on the left side too.
And I had a couple of skin grafts to cover up that ulcer on the left ankle, which I've been suffering from since I was 9 years old.
I remember that.
Opening and closing of the wound, but not because of skin grafts. Skin grafts never work. Open and close because of
Sickle-cell.
mental.
And no, but I was trying to. You said that your lung collapsed when you were.
Oh yeah, my lungs collapsed when I was 15 years old because I didn't have the proper preparation before the surgery. Because I was supposed to go in for, I did go in for a debridement of my sore, but because before surgery I'm supposed to have a blood transfusion.
Mm-hmm.
But since my hemoglobin was at a nice level, they decided to go out, which was a mistake because I ended up with my lungs collapsing.
Just
And
one.
Yeah, my left lung collapsing.
Okay. And then lung collapsed, and what happened?
Went into ICU, and during a blood exchange, my heart stopped, so they had to revive me. And after that, I had to go through treatments of the pounding on my chest to help inflate me.
Inflate the lung.
Reinflate the lung. Yes.
Goodness gracious. What else do you have written down here? She's got all types of stuff written down.
I suffer from pneumonia because of my sickle-cell crisis. I had a lot of problems with pneumonia before
You started getting the vaccine.
before I started getting the vaccine.
Okay. And before we were going through like what happened when you were between 1 and 5. I think you said that already. That was when you were swelling up a lot. And
I used to swell up a lot. My joints used to swell up a lot. My hands used to swell up a lot. So that since they didn't know much about sickle cell, they used to go in surgically to see why I was swelling. So I have like cut down scars
cut down scars.
on my body, like different parts of my body.
And then something when you were 9 was
When my sore began.
okay. And then between, I guess, 11 to 15, that's when you said that your lung collapsed, right? 15. Okay, and then 16 to 20. You know what, let's stop aging ourselves. Let's stop aging ourselves. So, something else major? Anything else major?
You know what I'm talking about, my gallbladder?
Yeah, you said you had it removed. And major medications that you're on.
Medications I am on: folic acid, Percocet for pain, Xarelto for blood clot condition, Topamax for headaches, Zofran for nausea,
Cheat sheet. She had everything written down.
Celebrex for arthritis, Pro Air to help with breathing.
So you can say it again if you, I don't know.
Xarelto for blood clot.
When did you get the DVT?
I got the DVT around age 15. I was in the bathroom using it, and I got this major pain in my groin area. And when they did ultrasound to find out that
Sorry, Toffee.
to find out that I had the DVT.
Okay. Okay, because we don't want Toffee to hate us. All right, so what would you say was your lowest point? Like, I'm tired of the sickle cell. I'm not gonna do this anymore. I don't deserve this. I'm not.
I was 16 years old, and the result of that feeling, I just stopped taking my medicine, which I was on, was hydroxyurea, very helpful for sickle cell. So I just stopped taking it to see if maybe I was feeling that maybe the doctors was wrong.
Okay.
And I was tired of missing out on family vacation, like to Ocean City. So I stopped taking my medicine, and that was a big mistake because medicine wasn't doing harm to me, it was helping me.
Okay, so stop taking. So how long do you think after you stopped taking the medicine did you go into the hospital?
The next day.
That quick? Okay. Well, that's better than it being like, 2-3 weeks with you born without even going into the hospital. And the next day you went to the hospital. Okay. And another question is, what is one thing that you say, sickle cell will not take this away from me? I don't care. I'm going to keep this.
My education, the ability to learn.
Toffee, stop it. Go away. You gotta get that home now. Okay, because she's all in your face. Like, okay. Sickle cell will not take your education. That's good. No thing should take anybody's education. Alright, and my last question is, can you draw sickle cell for me? What does it look like? What does it feel like it looks like when you are just in crisis, or even if you're not in crisis, just, sometimes you made a chart of the times where you're like, ouch, this is ouch, this is when my sickle cell feels like ouch, this is when it feels like, oh no, please stop, this is when it feels, even if you just draw what it feels like when it's ouch, or if you go all the way to when it feels at its worst. I just want you to draw a picture of Bianca's sickle cell. So we have some paper and we have some color pencils, and we're going to draw sickle cell. Well, you're going to draw sickle cell. I don't have sickle cell. Go ahead. Okay, so this is Bianca's picture of Bianca's sickle cell. And explain this picture to us.
Okay, this picture is in 3 stages of how sickle cell makes me feel.
Okay.
There's the ouch stage, where I'm in pain, but still going through, even with pain, of going to school and studying, talking to friends or family members, and watching TV.
Okay.
Then the 3rd stage. Can you see everything?
I can see it.
Sickle cell, please leave me alone. Is pain, where only way it will go away if I take pain medicine.
Okay.
And I'm praying that I'll continue doing without having to stop. Schooling, friends, family, watching TV.
Okay.
And then the last stage where the pain is too much, I have to be in the hospital, and all I'm thinking about is wanting to do school, hanging with friends and family, and watching TV.
Okay, so you're wishing to reverse it and go back to just ouch.
Yes.
Okay. Alright. Bianca,
Yes.
what do you have to say to other people suffering from sickle cell if they see this video? What do you want to say to them?
Stay strong no matter what. Make sure you take your medicine.
Take your medicine. Don't
Oh,
stop and think
and
it's going to go away.
And drink a lot of water.
Drink your water. Take your medicine. And stay strong. All right. Well, thank you, Dee. Welcome. Have a good. You're not in. Oh.